Welcome to Transform Now, the podcast brought to you by robotic process automation pioneer SS&C Blue Prism. Digital transformation has the potential to reshape the way companies service their customers, engage their employees, and manage their operations. Whether you're looking to develop strategies, tactics, or best practices to positively impact the future of work, or you're curious to see how other companies have successfully navigated their digital transformation programs, then this podcast is for you. We're here to help you transform now.
Hello, everyone, and welcome to the Transform Now podcast. I'm your host, Michael Marchuk, and today I'd like to welcome two guests to our show. Pawan Jadhav, CEO of Lateetud and Anna Twomey, the Senior Healthcare Director for Blue Prism's Healthcare Strategy Team. We'll be discussing the healthcare industry on this episode and the challenges with managing medical records from both a healthcare provider perspective and the healthcare insurer payers as well. So welcome.
Thank you.
Thank you very much. So before we get to the heart of the discussion, I'd really like to hear more about each of you from your backgrounds and how it relates to this important topic. So Pawan, we'll start with you.
Thank you, Mike. It's my pleasure to be here on the podcast. I have spent close to 20 plus years working with executives, both in front office as well as back office, whether it's financial services industry or healthcare. But the idea is how can we provide better outcomes for our customers? So now the need of the hour, as we say, is to see how we can provide cost-effective, but very personalized and better outcomes for our patients. That is the mantra, and that is the focus of the healthcare industry. And with that experience, we are creating solutions in partnership with Blue Prism and other strategic partners, where we are creating these solutions and bringing it to the healthcare industry. And that's one of the solutions that we'll be talking about. But that's a little bit of my background and how it aligns with what we are bringing to the market. And everything that we do is very process focused. And that's where it makes a lot of sense for what Blue Prism is doing and what we are doing. So we look at the process and how it impacts various entities within the process. And I'll talk a little bit more about as we go into the conversation.
Thank you, Michael. I'm Anna Twomey, and I am the Senior Director of Healthcare for Provider Solutions. And I work on the Healthcare Strategy Team for Blue Prism. I've had a dedicated career to providing transformational health IT solutions for both national and international partners in the medical markets. And this includes everything from working with high-tech solutions to actually back office solutions, working in revenue cycle management, serving as a consultant to revenue cycle management as well, and working within various departments of the healthcare arena.
All right. Well, thank you so much for introducing yourself. So Pawan, we'll start with you. You've seen a number of use cases for automation in the healthcare industry. How did you determine the medical record distribution was a high priority use case?
That's an interesting question. Now, the use cases span several areas, whether it's revenue cycle management, whether it's you're looking at back office operations like financials, or even operations like credentialing and onboarding, managing the entire supply chain, or whether it's front office when we're dealing with patients, patient engagement, their care management, or even on the clinical side. So there are various processes that can be automated using the technologies that we represent. But in all of this, you will realize one thing is that we are taking care of patients. And the way to take care of patients is always looking at what they are going through, what their history has been. And all of that is captured in data, which resides in various formats and in various systems, right? Whether it's EMRs or any health management systems, or whether it's even residing in claims, which the payers are receiving. And one of the challenges that the healthcare industry is facing, both providers as well as payers, is reviewing this data, extracting the data, understanding it, and making sense of it to perform various of these functions that I talked about. So when we started working with providers and payers, we realized that this always happens to be the first step, is how do you understand, extract, intake, and process this data? So we said, let's create a solution which is going to be focused on this aspect of it, because all the downstream processes are going to be dependent on the outcome of how efficiently we are able to extract that. So that's where we thought this would make a lot of sense. And so we are now integrating this solution and this technology in various aspects of different kinds of processes that we are doing for various departments within payers and providers.
That's very interesting. So Anna, getting these medical records to the right place at the right time can be challenging. Can you give us some examples of where the rapid distribution of these healthcare records would be important?
So, as Pawan said, you have to think about this, that medical records is generally the first go-to that we look at for a patient history and to find out what treatments they've received, what vaccinations they've received, and actually what diagnosis for billing purposes, for claims, but also for day-to-day services. You have patients that come and request copies of their medical records. You have legal agents that come in and request copies of your medical records. And then, of course, the payer's first go-to is, let's take a look at the history of this patient to determine exactly, what medications they're receiving or what types of procedures have been ordered for this patient. So it's generally a first go-to. We're seeing that a lot, probably even more since we've just come through a very highly intense pandemic that required a lot of people to visit their clinicians and maybe even visit medical homes that were not normal to them. So that means that there's an added complexity into getting a cohesive document together that shows the medical history of the patient, because maybe they visited an ER that they typically would not have, they were misplaced and had a COVID incident or something like that. And so it's gathering all of that data and information into a cohesive document that the payer organizations can use to process those claims. So I think that's probably been the indication of the uptick that we've seen more prominent lately with medical record requests. And the need to rapidly get those into distribution actually is very cumbersome, especially if you have to reach into different types of medical systems to satisfy one request. So that's why this particular solution is so imperative to the industry right now.
So, Pawan, Anna provided some use cases. Can you provide some more specific examples of how this might work?
So there are few use cases that Anna indicated, but let me try to be a little bit more specific. For instance, if you are transferring patients from one facility to another facility, or if you're doing scheduling for patient care, even when you are scheduling intake of patients. So if there is another facility from a different provider that calls you saying that they want they're referring patients, and these patients have to be then scheduled internally based on availability of care as well as availability of facilities. It could be even medical records that are reviewed while the claims are being processed. So whether there are right kind of medical records attached to a claim, whether it contains the key terms, whether it's CPT codes or IPT codes that are required to be reviewed as part of reviewing a claim, or even for pre-authorization, where we are sending a bunch of documents as well as information to payers to get pre-authorization for the process that is going to be, or for the procedure that is going to be performed. In all of these cases and more, you always have to review medical records. There is another use case which is very relevant to make sure that we are progressing in researching the medical data as well. And this kind of data is required by pharmaceutical and the health life sciences companies, where they need de-identified data, which helps them do better research and development in coming out better drugs for the patients. And in all of this, the medical data has to be extracted in many of the forms that I indicated before, including registrations, reports, operative reports. It could be PILs, it could be discharge summary, and so on and so forth. And that's where a lot of manual effort is spent today to extract that data. If there was a solution which can help, even may not be all the way through, but majority of this data that can be extracted, and in the use case that I talked about, if it can be de-identified and made available to various parties, there's a lot of value that this solution adds in making sure that there is a better healthcare provided to patients. We work with one of the customers where the transfer case that I was talking about, where patients had to be transferred from one facility to another. This particular use case came to light where we are using the solution. And the idea was to get the discharge summary, read through the discharge summary, identify the symptoms, the diseases, the context in which the care was provided, the CPT codes and IPT codes, and make that available to the staff that is reviewing that medical record, so that instead of going through hundreds of pages of the discharge summary, they are able to go through certain keywords that they should be focusing on, thus reducing almost 70% of the time required to review a case and then assist in transferring the patient. Right? So we are looking at anywhere between 70 to 80% of automation in medical review process in that particular use case.
Interesting. Anna, I'd like to turn back to you. So we talked about these examples. How is the automation actually meeting the need for faster availability of these medical records? What's involved?
I will also lead with an example of something that we just worked with recently. Actually, there are two of them. One of them is in the need for legal requests coming in and requesting medical records. In a recent customer study, working with legal requests coming in, the contact center was getting a lot of requests that were specific to a patient within a period of time. The agents not having access to all of those records available right there in their contact center would have to reallocate those to off service time, in which case it took about 30 to 40 minutes per request. And with 2,000 of these coming in a month over the course of an entire month, and there was a need for that, it's about 30 minutes allocated to each one, but actually automating that process so that as the contact information comes in, the dates are verified, the system processes the medical records out very rapidly in under 10 minutes. So you can see the variable change there from 30 minutes down to 10 minutes or less per medical record. So definitely cut back that backlog and took care of the issue right away. A second one that we've seen, again, from a different facility is denials management. When the payer issues a soft denial, typically they're just needing to see a medical record. So it may come in with a particular reason for denial, which would be a reason code. The digital worker can pick up on that reason code and say, oh, okay, they need us to attach the medical record for this particular patient, and go ahead and automate that. In real world instances with a human doing that, they may have to switch from their current task, log into the medical side of the house, go into the patient record and cut and paste from all of those different notes and variations of notes into a separate document, print that to PDF, and then forward that back to the payer organization. So there's been automation has made a significant change in how we manage denials to date. So that's another prime example that we've seen of cutting it down from somewhere close to 45 minutes down to under 10 minutes.
What does that do for the providers in this case? Does it change the way they handle the care?
The change comes from being able to provide patient satisfaction and reassurance. That same process, which it is a reusable process with the digital workers, can also update the patient records that are in their patient portal so they can have access to their own medical records from any location if they need to log in to their patient portal. So that's one way to increasing patient satisfaction if they need to get to that information very quickly because they're going to another appointment and need to have access to it. Another way is, of course, the betterment of their care is designed to take a look at what is in their medical history. So anytime they start to go and be treated for a different occurrence or a different encounter, there is a need to have those records transferred. So medical record extraction and transfer to the new facility, as Pawan pointed out, is also a way to increase the care of the patient.
Just to add to what Anna has indicated in this area, so the improved patient care is definitely one of the major ones. That even faster and accurate diagnosis, right? Because now the data is available to you, the data is highlighted, and based on the highlighted and available data, you can make accurate diagnosis, right? Nothing gets messed up. You can run analytics on top of this data and can gain more insights, right? For better care for other patients. So that's another way of looking at it. Even lowering costs. So one of the key things that the health industry is dealing with here in the US is the cost of care is very high. So if we are able to reduce these manual activities and lower the cost, the better it is for the entire value chain. So those are a few of the areas that this impacts directly. And it's all about data. It's all about some medical records within the industry. So we feel that this adds a lot of value.
That's interesting. Going through and digitizing and automating the processes can support both the provider side in terms of being able to get a better diagnosis, as well as the patient side. You mentioned a little bit on the payer side for lowering costs. Is there another benefit between the providers and the payers in terms of the revenue cycle?
This definitely increases the ease of use in revenue cycle. There's always a handshake between the payer and the provider, but in the example that I gave of a denial coming back from a payer for revenue cycle side, that means that that handshake could be automated, because the entire chain of command could be automated, because on the payer side, they're automating sending back the soft denial. And then from that point, another digital worker is picking it up and satisfying the return of the medical record. So it becomes a seamless line between the two. And that definitely reduces costs. That also reduces time to resolution, payment of claims. There's a whole different list of objectives that are met with it, with supplying that seamless interaction and complementary interaction to each other between the payer and the provider.
So assuming this is put in place and you have an automation component that's at the provider side, perhaps another one at the payer side interacting, what other services then become available now that you have this automation in play?
I will let Pawan answer some, but I can name off the top that your authorizations, your referrals, as he was talking about, the transfer of your patients, the payer has to be notified, the same as the new receiving facility. So this automates that, and it allows you to be able to transfer that information in multiple directions very quickly, because it's all automated without having to have a lot of different hands touching it as well. Your authorizations, your referrals, your send through, your denial checks, denials management as a whole. There's a lot of steps in revenue cycle that are reduced extensively with this process in play.
Just to add to what I think Anna covered it very well, just to add to this, pre-authorization itself, if you look at the CA2H data, CA2H indicates that the least automation exists in pre-authorization, primarily because that connection doesn't work very well. There's still faxes and manual operations that exist in pre-authorization, primarily on when the documents are flowing back and forth between the two entities. And we are also hearing that there is a government mandate coming in this area where this challenge has to be solved, right? So that itself is a big area where we believe that something like this can add a tremendous value, because if you're extracting information from EMRs, and there are multiple EMRs out there, and all that information is being stored in not in structured format, but in unstructured format. And if there is a way to extract that information and establish this in a cohesive manner, then this challenge can be solved. The other challenge, which I've already indicated, is how do you collect the data, de-identify the data, and then provide better care based on the insights that you gain by running data analytics on top of it. This kind of service can be used by the pharma industry. It can be used by the providers themselves. This can also be used by the payers, because now they can offer better products to their customers by looking at this data and analyzing this data.
So you brought up an interesting point that I think can't be overlooked. First of all was the discussion about the digitization of the data. Now, all this data that comes into the providers is in electronic format. And then further, where you take the unstructured data and try to manage it, how are you approaching those two angles when it comes to working within this medical records solution?
The underlying technology is powered by AI. So it is able to correlate different terms, different medical terms. First of all, it is able to identify different medical terms because there are dictionaries created which can identify almost 700 data elements, which are of unique types. And so first of all, it is identifying those data elements and then correlating those data elements to form a picture about the patient. That is combining few of the symptoms and coming to a conclusion, or at least coming to some kind of inference, is powered by and is provided by the AI engine that runs underneath. So that's where it's a very specific solution of solving, and it is a context-based solution where it tries to solve this problem for the healthcare industry by looking at the medical terms and trying to understand those medical terms. There is a long way to go, but there's what we have today makes a lot of sense and solves a lot of those problems.
And I'm glad you mentioned that, Pawan, because whenever you look at the research capabilities of the de-identified data, and this has been a study of mine for a very long time, and being able to extrapolate that data in an analytics tool where you can start to analyze, okay, so we've got a patient here that has a triple diagnosis or 3 comorbidities associated with that particular patient, and they fit a particular profile. You're not actually pinpointing that patient, but that patient type or a twin of that digital patient type. That helps you to be able to compare using AI, comparatively speaking, when new patients come in that fit that similar profile, the medications that have been working for them and the ones that have not. So you're starting to learn new treatment patterns that work best for patients that fit within a particular profile, within a particular twin. You also are able to take into consideration the human aspect of each of those patients and their likes and dislikes by using AI as well to start to see even a clearer pattern of how they like to be treated, if that makes sense. If a patient doesn't like to take medication 3 times a day, then their physician needs to know this patient will fare better on a time-released medication, for example. So whenever you start to analyze the digitized data, that's where a big difference in how we fundamentally treat our patients and improve their healthcare over time by looking at these objectively. Does that make sense?
Yeah, absolutely. Absolutely. Looking at the benefits, it sounds like we've got benefits across patients, the providers of the care, and the payers that are working with the providers to ensure that the care is delivered and paid for. So it sounds like there's all kinds of aspects of this that are being handled. By leveraging a solution like this, Pawan, and I'll give you the last word on this, tell me what's next. Where do you see this going in terms of the future?
In our digital operating model, what we have been seeing and what we recommend to customers is if you are able to solve the data extraction problem, it doesn't matter what industry it is, then there are a lot of use cases that can be automated just because you're able to solve the data extraction challenge. Because now all of a sudden you have made that unstructured or unreachable data reachable in a structured format, and software robots or workflow systems or analytics, etc., can then use that data to automate end to end. So now that we have created a solution to start solving that challenge, our intention is now, how do we solve the process challenges that the customers have? It could be automatic processes within an enterprise, but it could also be looking at connecting with because if you look at healthcare industry today, the data resides in silos, it resides in various systems, it's a very fragmented data that is there in providers. This whole industry is very fragmented. And if we start connecting the dots and solve the problems, the data challenges, then there's a lot that can be done in this space. So we are looking to expand the solution and go into the areas through this kind of the mindset of creating a digital operating model for the entire industry.
That's excellent. Thank you so much again for going through that, Pawan and Anna. I really appreciate you providing some insight as to how these types of solutions can really provide benefit for both providers and payers, but also for the patients that are at the end of the day, why we're doing it. So thank you again for joining us today. I really appreciate it.
Thank you very much for having us, Michael.
Thank you, Michael. We appreciate it.
Thanks for tuning in to Transform Now. For more insightful discussions on digital transformation and more, check out our podcast channel where you'll find all of our previous episodes. And to make sure you never miss an episode, subscribe to the show on your favorite podcast player. And if you like what you've heard, please leave us a review. For more information about digital transformation and the future of work, check out blueprism.com to learn how SS&C Blue Prism's digital workforce is enabling enterprise transformation now.